For this video, we're going to look at the extrinsic muscles of the eye. You have a series of 6 muscles whose job it is to move the eyeball around in the socket so you can look in different directions. This is actually not too tough. It looks like it's complicated, but it's really not too bad. There are 4 muscles called rectus muscles that basically pull the eye in particular directions. Up here, for example, we have a superior rectus muscle, and when that muscle contracts, you can see the fibers pulling to contract. When those muscles contract, they're going to rotate the eye directly upward, superiorly. On the outside, there's a lateral rectus, which basically pulls the eye out to the side. It abducts the eye. And so lateral rectus will contract and pull the eye so it's pointing away from your nose, so it's going to point laterally. And then let me move this out of the way. And then in here, let me raise that up. You can see the medial rectus here. That's going to pull the eye pointing roughly in towards your nose. And then if we look way down in here, at the very bottom, we can see an inferior rectus, and when it contracts, it's going to point your eye inferiorly. So it's going to point it straight down. There are also 2 oblique muscles, the word oblique meaning at an angle. There is a superior oblique muscle here that runs up along the socket of the eye, and you'll notice this little hook here called a trochlea. And then you'll notice the tendon coming in to grab onto the eyeball and actually attaches here in the superior posterior portion of the eyeball. And when this muscle contracts, it pulls this, and it works like a pulley, pulling this tendon this way. And what happens is the eyeball winds up rotating to where, even though this is getting pulled this way, the pupil winds up pointing laterally and inferiorly as a result. And then underneath here, we have an inferior oblique muscle here wrapped around, and it actually comes around and grabs onto this aspect of the eyeball over here. And so when this muscle pulls this way, pulling this way, it actually rotates the pupil superiorly and laterally. So it's going to point it up and out. While the superior oblique is going to point the eye down and out, the inferior oblique will pull it up and out. And so you have a variety of motions there. You can move your eyeballs in a variety of directions. And these are very, very fast twitch muscles, so it happens very quickly. One more thing I did want to note, this big structure coming back from the eyeball here is the full optic nerve coming back, and it would make what's called an optic chiasma with the other optic nerve on the other side. Some of the fibers there, the nerve fibers, will actually cross over to the opposite side as they move back toward the occipital lobe of the brain.